So we looked at the outcomes of 187 multiple myeloma patients who were treated in a single center, and they were treated with VRD induction followed by autologous stem cell transplantation with melphalan-200 conditioning and lenalidomide maintenance. So after induction, the CR rate was 9.6%, and VGPR or better was 52.9%. And at day 100 post-transplantation, those responses improved to 29.4% CR or stringent CR and 74.9% VGPR or better. The 5-year PFS was 43.1%, and OS was 79% overall. High-risk cytogenetics were associated with worse outcomes. So overall, our study showed that this standard of care regimen has good outcomes, especially in patients with standard risk cytogenetics. However, recent developments such as using frontline quadruplet regimens or other drugs, all modalities available on progression, has led to improved outcomes.